sound check November 28th. Board of Health, sound check November 28th, sound check.
This meeting of the Board of Health to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Presentations and reports considered at this meeting are available on the city's website, and members of the public can contact the clerk's office to acquire documents in an alternate format. As per usual, all electronic devices are to be switched to a non-audible function during council meetings. Members are reminded of the 5-minute time limit, which will be adhered to during this meeting. Members can submit another request to speak if they require more time to ask questions or make comments. I believe that quorum is present. And so the first order of business is the nomination of our vice chair for the Board of Health. Is there anybody who is prepared to nominate the vice chair for the Board of Health for the term? Nominated by Councillor Crouch, seconded by Councillor Nan. Who are you nominating?
Councillor Maureen Wilson.
Okay, Councillor Maureen Wilson. Is there a seconder? Councillor Nan. Thank you so much. Are there any further nominations for the position of Vice Chair of the Board of Health? Seeing none, there being no further nominations, can I have a motion to appoint Councillor Maureen Wilson as the Vice Chair of the Board of Health for 2022 to 2026? That's moved by Councillor McMeekin and seconded by Councillor Huang. All those, you can please cast your ballots, cast your votes. Thank you. The vote is being reopened because of a glitch. Oh, it worked for me. It came up the normal way. Sorry, folks who might be watching. We're having a bit of a technical difficulty this morning.
And that vote carried 8-0. Thank you for your patience.
Thank you so much. Congratulations, Councillor Maureen Wilson. Madam Clerk, are there any changes to the agenda?
There are no changes to today's agenda, Madam Chair.
Thank you. Can I then have a motion to approve the agenda? Moved by Councillor Huang, seconded by Councillor Pauls. Are we voting again? Let's see if it works this time. We're going to give it another shot. Please indicate your votes when you're able to.
The vote is opening. Still not, okay. Gotcha. Some are able to vote online and others not. Councillor Spatafora, thank you very much. To 0.
Thanks very much. Members of Council, are there any declarations of interest?
I'm going to recommend that we vote by show of hands for this meeting so that I get a correct vote. eScribe is not doing it for me today. So if we could just, as we move forward, I can see that you're all giving me a show of hands, so in the minutes, the votes will be shown correctly.
That's helpful because I think as Councillor Maureen Wilson noted, the vote said it was 8-0, but there are more than 8 of us in the meeting this morning. And so just for the folks who might be watching, there's been a technical glitch with our voting system, our electronic voting system. So we're going to vote by show of hands for the remainder of the meeting. Thank you, Councillor Maureen Wilson, for that. Okay, and so that did carry, and I'm not sure how many votes we had, but we did see that carried completely. So the next issue then is, are there any declarations of interest that members of the Board of Health would like to declare? Okay, seeing none. Let's see. Can I then have a motion to approve the minutes as presented of the September 26th meeting? Moved by Councillor Pauls, seconded by Councillor Maureen Wilson. All those in favor? Any opposed? That motion carries. I'm in favor as well. Are there any questions regarding the 3 communication items on the agenda? That's our next item is communications. Are there any questions, comments on the communications? We have 5.1, 5.2, 5.3. All right, seeing none then, can I have a motion? Oh, I'm sorry. I'm sorry, Councillor Nan. Go ahead, please.
Thank you. Through you, Mayor, just a question to staff. I appreciate the correspondence 5.1 from the Ministry of Health in respect to providing provincial supports for COVID-19 response and recovery. There is an indication of 31 million. I assume that's provincially for the school-focused nurses initiative, which is really important, as well as the 47 million cost-sharing mitigation funding through to 2023. So if I could, through you to staff, just getting clarity around when do you think you'll hear from the province in terms of what might be coming through to Hamilton Public Health? Thank you.
Director Vickers-Manson.
Thank you. Jen Vickers-Manson, Director of Healthy Families, Chief Nursing Officer for Public Health Services, through the chair to the councillor. That is correct. Those amounts are for the province. And what we've been told, as we have been told for each year of the pandemic, that the province will consider our application for extraordinary funding for COVID and related expenses for 2023. The province has not indicated any terms or restrictions on funding at this point, and will continue to track and submit these costs via both the city and provincial budget process, as we have done in previous years.
Thank you. And then if I could, through you, so our previous year application is end of year and we find out at the beginning of year, just to clarify for my council colleagues as it relates to the budget process. Thank you.
Thanks, Councillor Nan. Director?
Through the chair. That's correct.
Thanks so much then. So that was 5.1. 5.2 is the Windsor-Essex County Unit Board of Health correspondence. The recommendation, of course, is that it be endorsed. And then the correspondence regarding the health concerns in the upcoming flu season from Good Life Fitness. So may I have a motion to approve the items as presented? Moved by Councillor Spadafora, seconded by Councillor Beattie. All those in favor? Any opposed? That motion carries. So the next item on the agenda is a presentation from the staff. As there are no delegation requests and no delegations. So 8.1, the Board of Health Orientation. Director Vickers-Manson, is that something you're going to carry for us?
That's correct. I'll just introduce the Board of Health Orientation for 2022-23. So with each new term of council, we undertake to orient our Board of Health to their role in the programs and services provided by Public Health Services. The first session provides a general overview of the legislative basis for local public health and the Ontario Public Health Standards. Further details about population health, the health status of Hamiltonians, and the annual service plan and budget will be coming forward as separate reports and presentation in January and February. I'd like to introduce Carolyn Hero, who's the Program Manager for Public Health Planning, who will go over the presentation. Myself and my colleagues will assist with answering any questions you may have.
Good morning. It's a pleasure to be here today at the first Board of Health meeting of the new term, so welcome everyone. As Jen mentioned, today I'm going to initiate the Board of Health orientation with you. However, recognize that you're probably being inundated with information right now, so we've phased it out over the next couple of Board of Health meetings. Today, I will provide an overview of the Board of Health governance and accountability requirements as per the relevant legislation and standards. And I'm also going to go into more detail about your roles and responsibilities as a Board of Health, because there are separate legislative mandates that you have as a Board of Health, as you do with many other parts of the organization. In January, as Jen mentioned, we will bring forward a presentation to highlight some of the emerging health issues and trends in Hamilton, as well as an overview of our public health priorities over the next few years. And in February, you'll learn more about our program plans as we bring forward the annual service plan and budget, which is a ministry submission. Before I get started, I did want to mention that the Association of Local Public Health Agencies has recently updated their Board of Health orientation manual. And so that's a great resource for you. And we'll go into more in depth into the topics that I'm going to be discussing today. So I have included a link at the end of the PowerPoint for your reference. I also wanted to note that 2023 will mark the 150th anniversary of public health in Hamilton. And Hamilton's first Board of Health was established in 1873. And Dr. Charles O'Reilly was our first appointed medical officer of health. So just a little bit of history there for you. I'm going to start off by providing just a reminder about what public health is. And the reason for that is that we often do get mixed up with others who are part of the broader health and social sector. So public health is the organized efforts of a society to keep people healthy, prevent injury, illness, and premature death. It is a combination of programs, services, and policies that protect and promote the health of all Canadians. And that definition comes from John Last. One of the easy ways to remember public health's role is to think about the 3 Ps, and those are protection, promotion, and prevention. So we protect health by controlling infectious diseases through regulatory inspections and enforcement, and by preventing or reducing exposure to environmental hazards. We promote health by educating the public on healthy lifestyles, working with community partners, and advocating for public policy that promotes a healthy population. And lastly, we prevent disease and injury through surveillance of outbreaks and immunization to control infectious disease. There are 2 key factors that are unique to public health compared to the rest of the health sector. The first is that while individual physicians and health agencies tend to focus on the individual patient or client, our focus in public health is on the entire population or segments of it, such as high-risk populations. And the second factor is that our public health programs have a really strong focus on the social determinants of health and health equity. So health equity being that all people can reach their full potential, full health potential, and are not disadvantaged from attaining it because of their race, ethnicity, gender, age, socioeconomic status, or other socially determined circumstance. So in order to decrease health inequities, we often use something called a population health approach, which means that we really direct our efforts and our investments upstream to address the root causes of health issues and illnesses. I'm going to play a short video, hopefully it works here for you, that'll talk about that a little bit more.
Standing on the edge of a river. All of a sudden, a flailing, drowning child comes floating by.
Sorry, can you hear that? Or no?
Here we go.
Standing on the edge of a river. All of a sudden, a flailing, drowning child comes floating by. Without thinking, you dive in, grab the child, and swim to shore. Before you can recover, another child comes floating by. So you dive in and rescue her as well. Then another child drifts into sight. And another, and another. Eventually, hopefully, some wise person will ask, who keeps chucking these kids in the river? And they'll head upstream to find out.
They get upstream to find an old wooden bridge that is in serious need of repair. Soon they realize that the children are falling into the river because they're stepping through a large hole. They decide to fix the problem at its source and immediately work together to repair the bridge. This prevents the children from falling into the river. Going upstream allowed them to see what was happening to the children in the first place and to deal with the problem at its source. Thinking upstream means to focus on solutions to problems that have the greatest impact on the health of populations. Upstream solutions create conditions for all people to enjoy true health and experience complete physical and social well-being. Upstream thinking is the stuff of public health.
All right, so often what we find as a society, we've been very reactive to issues that have happened, from issues around income, poverty, climate change, et cetera, as opposed to being more proactive. And so in public health, most often we're talking about promotion and prevention in terms of these health issues. So in other words, thinking upstream. I'm going to take a few minutes and talk about public health in our province. So in Ontario, public health programs are delivered in communities within local public health units, each of which is governed by a board of health. And currently there are 34 public health units across Ontario. A few years ago, there were 36 public health units. However, there have been some amalgamations between health units, and really those were those resulted from recommendations related to SARS and other significant health events about how to improve capacity in public health across the province. So the map on this slide shows how public health units are often categorized into regions. And so, of course, in Hamilton, we are down towards the bottom, and we are part of Central West, along with Wellington, Dufferin, Guelph, Halton, Waterloo, Brant, Haldimand, Norfolk, and Niagara. At the provincial level, we of course have the Minister of Health, and the Minister of Health is the cabinet member with the portfolio for public health, and will typically be the lead minister named in public health legislation. We also have the Chief Medical Officer of Health, who has a critical role in leading the public health system as a whole. One of the more recent changes was the creation of Ontario Health in 2019 to support a more integrated healthcare system. by having one central agency that coordinates the work of what used to be separate public health agencies. And I'll talk a little bit more about Ontario Health in a minute. Public Health is also fortunate to be supported by Public Health Ontario, which is an arm's length government agency that provides scientific expertise and advice to government and public health units. In terms of funding, the majority of our public health programs are cost shared between the province and the municipalities. So currently the funding formula is 70% funded by the province and 30% funded by the municipality. And this was a result of a change by the government in 2020. So previous to this, the funding formula was 75% provincial and 25% municipal. And that had been in place since 2007. The remainder of our programs are either 100% provincially funded or 100% municipally funded. So a few examples of the 100% provincially funded programs include our Child and Adolescent Services and our Ontario Seniors Dental Care Program. A few examples of our 100% municipally funded programs include the residential care facility inspections, pest control, and adult dental treatment. So moving on now to the legislation and the standards. So there are all sorts of acts that have references to either the Board of Health or Medical Officer of Health in terms of expectations. So some examples include the Immunization of School Pupils Act, the Safe Drinking Water Act, and Smoke-Free Ontario Act. The one I'm going to focus on today is the Health Protection and Promotion Act, and that is the primary piece of legislation that governs public health. The Ontario Public Health Standards are published under the authority of the Health Protection and Promotion Act. And so together, the HPPA and the standards govern nearly all of the activities of the Board of Health. So I'm going to discuss them a little bit further on the next few slides. The Health Protection and Promotion Act, or HPPA, is the legal authority to establish boards of health and requires that each public health unit be governed by a Board of Health. It highlights that Board of Health members are held in a position of trust and held to a high standard of conduct, which is generally subject to the same basic duties of stewardship imposed on business and non-profit corporations. It also outlines the responsibilities and authorities of the Board of Health, as well as the powers of the Medical Officer of Health and staff. And lastly, it outlines that boards of health are required to comply with the HPPA, the regulations that are within those, and the Ontario Public Health Standards. The Ontario Public Health Standards really set out the minimum expectations for what boards of health are expected to deliver. So one thing that's really important to remember is that these standards were put in place to increase consistency across public health units. And that really came from, it was a common criticism coming out of SARS and Walkerton, was that at times there were very different approaches being used by different health units. And so again, these standards were put in place to improve standardization. That being said, there is recognition that the 34 public health units have different demographic, geographic, economic, and social conditions. And so within the standards, the ministry is very explicit about the importance of assessing local needs to identify the most significant health issues, and also provides flexibility to health units to tailor planning and service delivery in order to meet those needs. The standards have several different components, so I'll just talk about those a little bit, each a little bit. The first component is the accountability framework, and it was added to the standards in 2018 after a fulsome review. The purpose of that framework is to ensure that boards of health have the necessary foundations for the delivery of programs, financial management, governance, and public health practice in order to really support a strong public health sector and demonstrate how public health contributes to the population health outcomes. The second component are the 4 foundational standards that outline requirements that underpin all of our programs and services. In other words, all of our programs are required to act on these. So of course, health equity that aims to decrease health inequities, population health assessment that involves analyzing local data to identify needs within the community, effective public health practice, and emergency management. The last component of the standards are the program standards, and those include chronic disease prevention and well-being, food safety, healthy environments, healthy growth and development, immunization, infectious and communicable disease prevention and control, safe water, school health, and substance use and injury prevention. Under those 9 program standards, there are a total of 70 outcome-focused requirements. And again, those outline the minimum set of requirements for boards of health, but provide flexibility to tailor programs locally. So rather than list off those 70 requirements, I thought I would go through each of our divisions and talk about the work of the programs at a high level. So in Hamilton, we have the Office of the Medical Officer of Health and 4 divisions: Communicable Disease Control Division, the Epidemiology and Wellness Division, Healthy Families Division, and Healthy Environments Division. Within our Communicable Disease Control Division, we have the Infectious Disease Program that aims to reduce the burden of communicable and infectious diseases by investigating infection prevention and control complaints and providing education about how to reduce transmission. Of course, we also manage infectious disease cases, contacts, and outbreaks to minimize public risk. I think that's probably the one that folks are most familiar with after the last couple of years. We also have our vaccine program that aims to reduce the burden of vaccine-preventable diseases through immunization. And so that includes our school immunization programs, as well as delivering immunization education sessions and distributing and promoting different vaccinations, including COVID-19 and influenza. And lastly, within this division, we have our emergency management portfolio. So you'll recall that this is one of the foundational standards. And so although emergency management is under this division, it really supports management across all public health divisions. Within the Epidemiology and Wellness Division, we have Epidemiology and Evaluation Team, as well as the Data Management Team. And those 2 teams are responsible for providing data and business support to ensure programs are evidence-based and responsive to local needs. And they also support continuous improvement and quality assurance initiatives. Also under that division, we have mental well-being and substance misuse prevention. So the focus of these programs, of course, on mental health, mental well-being, substance use prevention, harm reduction initiatives, and outreach services for vulnerable populations. So to do this, they work through our street health clinics. They provide safe injection supplies, distribution of naloxone kits. And we also have our alcohol, drug, and gambling services and mental health street outreach program that is not mandated under the standards, but just wanted to flag that for you as well. And this program provides free services to support those with alcohol, drug, or gambling concerns, offering counseling and group programs. There is also a team of staff who work in the community with individuals who are homeless or staying in shelters to connect them to different supports, including income sources, healthcare, housing, etc. Next, we have the Healthy Environments Division. Within that, we have the Chronic Disease Prevention and Wellbeing Program that aims to reduce the population level burden of chronic diseases and improve well-being. And some of the areas of focus of that program right now are on food security, healthy built environments, and of course, physical activity and sedentary behaviors. Our tobacco control program focuses on smoking cessation, tobacco use prevention, and protection through enforcement. We also have the Health Hazards Program that investigates reports of health hazards, conducts West Nile virus and tick surveillance, provides education and surveillance of local air quality and climate change, of course, supporting the corporate climate change action strategy. And lastly, within this division, we have food and water safety. And so this program really aims to prevent or reduce the burden of food and waterborne illnesses by conducting regulatory inspections, investigating food and water illnesses and outbreaks, and providing education regarding food and water safety. And last, we have our Healthy Families Division. We have our Healthy Growth and Development Program, which provides programming that supports Hamilton residents to achieve optimal growth and development through various stages that are listed there. They do this by providing online prenatal classes, breastfeeding consultations, as well as our home visiting service. Under this division, we also have our dental programs. So they provide free dental services for Hamilton residents of all ages who have either low income or do not have dental insurance. We also have our Child and Adolescent Services Program, and this is another one that, again, is not mandated under the standards and provides outpatient mental health services to children, youth, and their families. Our school program collaborates with school boards and schools to identify health needs among school-aged children and supports initiatives that really promote the adoption of healthy behaviors. We have our health equity program. So as I mentioned, this is another one of the foundational standards. So all of our public health programs are responsible to aim to decrease health inequities. And this specific team, although it's under Healthy Families, supports the work of the rest of public health programs by staying informed about best practices and approaches, providing consultation, and also developing evidence-based strategies. Our planning and competency development team, which is the team that I lead, supports public health leadership team as well as programs with strategic and program planning, preparation of ministry reports, and building competency among staff. And so again, I know that's a really high-level overview of all the programs. However, you will learn more about each of their work plans when we bring forward the annual service plan and budget in February. I'm going to take us back for a few minutes to the accountability framework within the standards. So as I mentioned earlier, this framework was implemented in 2018 to ensure all public health units across Ontario were following good business practices. And so there are 4 main areas that we are accountable for, including the delivery of programs and services to make sure they are done in accordance to the standards, fiduciary responsibilities to make sure we're using our funding efficiently as for its intended purpose, good governance practices to ensure that the Board of Health is functioning well, and public health practice. So what does that mean? It really means that we have to ensure we're achieving a high standard of quality in the delivery of programs, that we're up to date on evidence and research, and of course that in Hamilton we're contributing to the knowledge base of public health. And so there are 2 main documents that outline the requirements of boards of health in carrying out these good business practices. The first being the organizational requirements within the standards, and there are 20 of those. as well as our public health funding and accountability agreement. So of course, public health units are also required to submit several reports to the ministry to demonstrate compliance. And I have those listed here for you on the slide. So you'll see that we will be bringing forward quite a number of reports over the next few months. So getting into a bit of the Board of Health structure now, there are four main governance models across Ontario: autonomous, regional, single tier, and semi-autonomous. The majority of public health units, 24 in total, have an autonomous structure where the Board of Health is separate from their local government. 6 public health units operate under the administration of their regional government. So examples include Halton, Niagara, and Peel. And then you'll see on the slide that single tier and semi-autonomous are in the same color. And that's because they are often grouped together, but there are some important differences that I wanted to highlight. So under single tier, there are 2 public health units that operate under that structure, whereby the municipal council serves as the Board of Health. So of course, Hamilton being one, as well as Haldimand Norfolk. And then we have the semi-autonomous structure, which is slightly different in that municipal council appoints members to a separate Board of Health that is arm's length. In this model, it is possible to appoint citizen representatives, and both Toronto and Ottawa fall into that category. So as I mentioned, Hamilton currently has a single-tier Board of Health structure, and under this model, a municipal councillor on the Board of Health has 2 hats: the municipal politician and the public health advocate. I just wanted to note also that post-SARS, there was an article by Justice Campbell that talked about the challenge that you have as councillors to be both a municipal politician responsible to your electorate, as well as serve as a Board of Health member. And in part, this committee structure, the single-tier model, allows you to formally do both at the Board of Health and at council meetings, where you can wear your other hat. In terms of roles and responsibilities, the primary role of the Board of Health is to provide good governance and strategic leadership to the organization. The role of the Medical Officer of Health and all staff is to be responsible for the management of these programs and to report back on any issues that we may be experiencing. And of course, as councillors, you also have a really important public health role as public health champions on a day-to-day basis in supporting the community to be as healthy as possible. So I wanted to get a little bit more into governance right now. And to provide context on this slide, I've included a bit of a timeline that provides an overview of the recent Board of Health governance discussions and reports that have taken place over the past couple of years. So in March 2021, there were a number of delegations highlighting the need to restructure Hamilton's Board of Health to include diverse community leaders and health experts from within Hamilton. As a result, the Board of Health requested that staff prepare a report outlining the history of Board of Health governance in Hamilton and the various Board of Health structural models that I just reviewed. And that report was brought forward in June 2021. At the request of the Board of Health, there was a Board of Health governance education session in September 2021, and that was led by Karima Kanani of Miller Thompson Lawyers to provide an overview of governance structures as well as good governance principles. Following that, staff were directed to connect with Toronto and Ottawa Public Health to learn more about their semi-autonomous Board of Health structure as a model, as a way to include citizen representatives on the Board of Health. At the Board of Health meeting this past July, we highlighted that any changes to current Board of Health structure in Hamilton would require legislative change, under the City of Hamilton Act and may require changes to this regulation under the Health Protection and Promotion Act. And so the last direction from the Board of Health was to request information from the province about the feasibility of including members of the public on the Board of Health. And so we did submit a letter to the Minister of Health in July. However, we have not heard back to date. And so I am highlighting this today to provide context as I talk about Board of Health governance. However, just noting that we will be bringing back a more fulsome report in April to continue that discussion and determine next steps. So these are the principles of good governance that Karima Kanani shared during her session. And as you can see in the top right-hand corner there, board composition and structure is one of these principles. Specifically, that board members should collectively reflect proficiencies of a skills-based board and should be representative of the community that it serves. The other principles she spoke about were board conduct and processes, so the use of bylaws and policies to provide rigor and clarity to board procedures, as well as effective management of board conduct. Relationship of governance and management, so again, that gets back to the clarity of roles and responsibilities that I just spoke about between the Board of Health, the Medical Officer of Health, and staff. Enterprise risk management, community and stakeholder engagement. So collectively as a board, it is critical to systematically engage and consider the perspectives of the community in decision-making to advance the needs of the community as well as equity, diversity, and inclusion. Board evaluation is another principle. It demonstrates a commitment to continuously improve board governance and effectiveness. And this is actually one of the organizational requirements under the standards. Boards of health are required to conduct a self-evaluation every 2 years. And the last principle of good governance, of course, is stewardship. So as you're well aware, the health system is undergoing significant change and has been for a number of years. And I wanted to highlight a few things that are important from a public health perspective. So as I mentioned earlier, Ontario Health was created in 2019 to support a more integrated healthcare system by having one central agency that really coordinates the work of the health sector. And so as a result, Ontario Health subsumed a number of different health agencies. So examples include Cancer Care Ontario, eHealth Ontario, Health Quality Ontario, etc. And so it is important to note the different reporting structures. So Ontario Health reports directly into the Minister of Health. Public Health also reports directly into the Minister of Health. And so although we have those separate reporting structures, we still work collaboratively as health sector partners. In November 2019, the ministry announced the Hamilton Health Team as one of the first Ontario Health teams in the province. And so now that group is known as the Greater Hamilton Health Network, or GHIN. And this team is a collaboration of Hamilton Health and Social Service partners and includes representation from more than 20 organizations across Hamilton. And so currently Hamilton Public Health is a partner with the Greater Hamilton Health Network while maintaining its unique role in the health system. And lastly, of course, for several years now, there have been ongoing provincial discussions about possible changes to public health. And that really, most recently, in April 2019, the Ontario budget included plans to consolidate the then 35 public health units into 10 new regional public health entities. November of that same year, the ministry released a discussion paper on public health modernization and outlined key strengths and challenges of public health across Ontario. And Hamilton did provide a collective response to that, really advocating for public health to maintain its unique mandate to keep our communities healthy, prevent disease, and reduce health inequities, and also to keep public health local. So to preserve the independent local authority for planning and implementation of public health programs. Early in 2020, the ministry started to conduct consultations in various jurisdictions, and we did have a consultation here in Hamilton to gather feedback and input about the public health system transformation. Of course, in March 2020, when COVID hit, that was put on hold and has been on hold since that time. However, they have indicated that we can expect further updates in terms of public health transformation in the spring. So to wrap up here, just a reminder that we have phased the Board of Health orientation over the next few meetings. I know this part is probably the driest part, so thank you for your attention. Again, in January, we will be bringing forward a presentation that will highlight some of the emerging health issues and trends in Hamilton, as well as an overview of our public health priorities for the next few years. In February, we will bring forward that annual service plan and budget, and so you'll get to know a little bit more about our program plans for the next year. And then in April, we will be bringing back a report on Board of Health governance to continue that discussion. And lastly, I wanted to flag that we are planning an in-service session with your administrative staff to really review public health specific information and contacts so that they can support your constituents and their needs. And so we're just determining a date for that, but we will get back to you on that. And lastly, this slide includes some links of some of the documents I've talked about today. So the Ontario Public Health Standards, the Board of Health Orientation Manual, as well as the reports related to the Board of Health governance piece. So thank you for your time today, and I'd be happy to answer any questions that you have.
Thank you, Manager Hero. Appreciate the presentation. I'm just wanting some clarification here. The roadmap says we need a motion to receive the presentation. So can I please have that motion? Moved by Councillor Noun, seconded by Councillor Maureen Wilson. All those in favor? Any opposed? That motion carries unanimously. So we now have to have a motion to put the report on the floor for discussion, correct? All right. So can I have a mover for that? Councillor Kretsch, moved by, seconded by Councillor Huang. All those in favor? Any opposed? That as well carries. So there are questions from the board members, and my understanding is, beginning with Councillor Kretsch.
All right. Thanks, and through you, Mayor Horvath, to Director Stahl. Thank you for showing up. I appreciate it. I had a quick question for you to start off. I know that during the presentation, it was mentioned that we sent a letter to the province in July of 2022 with respect to asking for their input on changes to add members of the public to the Board of Health. And I know that during the presentation it was mentioned that we haven't heard back yet since July. And I wondered if you could maybe speak to that, speak to what do you think normal timelines are to hear back, and if there's anything we do to follow up about that so we can get an answer in time for a discussion in April of 2023.
Sounds good. Thanks, Councillor Kretsch. Manager Hero.
So through the chair to the councillor, that's a great question. We usually hear back, I would say, within a few months, and we haven't this time, but maybe I will hand it over to Director Jen Vickers-Manson for further comment.
Director?
Thank you, and through the mayor to the chair. Timelines vary, and it depends on the type and content of question being asked by the ministry, and so I think the answer Carolyn provided is accurate and the most up-to-date information that we have at this time.
Thank you,
Chair,
Councillor
if
Critch.
I may, Director Stahl, Morgan Stahl, Director of Government Relations and Community Engagement. I believe the member of council asked if there's anything further that we can do in order to receive a reply on that letter. So the letter that he is referencing was from July 19th, 2022, and that did go to Minister Jones, as well as the Chief Medical Officer was CC'd on that, and it was also flagged for ministry staff in health. I think that from my perspective, I can follow up from a GR standpoint with some of the folks, both in the political office, in the Minister of Health's office, and our ministry contacts in order to see if there is any further communication that's expected to come from them, or if there are any ways we can continue to push our priorities on behalf of the city.
Thank you. Councillor Critch?
I had a couple other questions. I had two other questions. One, I noticed that there was I forget the name of the division, so I only remembered the subdivision, sorry. I think it's food and water safety was one of the subdivisions, and I know I'd asked a question during another meeting, one of the budget meetings, about the swimmability of our water in the harbor. And I know at that time someone said, hey, that's a public health thing, and we'll work with our partners in public health. And so from a governance perspective and understanding how these departments work together, when something comes to water safety, like who is jurisdiction over that? How do departments work together? How do we action things across committees in that way? And I'd love a thorough understanding of that if you have one.
So through the chair to the councillor, thank you for the question again. I'm going to actually pass it over to Director Kevin McDonald, who is the Director of the Healthy Environments Division.
Director McDonald?
Yeah, through you, Mayor, as Chair, thank you very much, Councillor, for the question. So our office and our program works closely with both Hamilton Water, Public Health, as well as the Ministry of the Environment, Conservation and Parks, as it relates to our annual beach water sampling program. You'll see that information on our webpage in terms of those specific sites that we test. In terms of swimmability in the harbor, Richard McDonald is here as well to speak to another matter later on the agenda, so it's very opportunistic, I think, for me to call upon Richard to talk about our recent experience in terms of harbor beach water sampling and what we're seeing going forward.
Good morning. My name is Richard McDonald. I'm the Food and Water Safety Manager with Hamilton Public Health Services, through the chair. So as far as swimmability, we have 7 beaches that we do annual monitoring for throughout the city, some of which are Hamilton Conservation Authority, Niagara Peninsula Conservation Authority, and then our city-owned beaches. So we conduct beach sampling on a weekly basis from about June to about Labor Day weekend in September, at which time then we post the beaches, which, to indicate whether or not they're swimmable, and we disclose that on our website.
Thank you. Councillor Critch?
Thanks. That answers my question in terms of the governance questions. Thanks very much. I appreciate it. I had one last question, which was about medical officer of health orders. And so I know that the medical officer of health can issue orders at times through the Act. And I was wondering if anyone had a sense of whether or not our medical officer of health historically has issued orders, the kinds of orders that get issued, just in terms of examples of the kinds of orders that eventually get issued. I know it's not used regularly, but I wonder if there's anything anyone knows about the kinds of things that we do see happening. Curious.
Through the chair to the councillor, I'm going to suggest that I pass this over to Dr. Bart Harvey, who's joining us online as our Associate Medical Officer of Health, to answer your question around what are the types of orders that a medical officer of health could use.
Oh, I just wanted to clarify. I was curious to know, not the ones they could do, but ones that have been done, right? Thank you.
Thank you. Thank you for the question, and through the chair. So I think overall, I would say that orders hopefully are a last resort, and that in most cases where we need people to kind of follow instruction, we will get that by volunteer agreement. but when necessary. So the places where orders, and usually medical officer of health orders are issued to individuals, not to populations or communities, but to individuals. Certainly in the area of communicable disease, they will play a key role. So in instances where we need somebody to isolate so they don't put other people at risk in cases like tuberculosis, or we need people to get tested so we can determine whether they are infected and need treatment. And then, of course, health inspectors also have the ability to issue orders around environmental health issues. Hopefully that helps.
Thank you, Associate Medical Officer of Health Harvey. Councillor Kretsch, you have a
Thank
minute.
you. That's good. Thank you.
Thanks so much. The next is Councillor Maureen Wilson. Go ahead, Councillor.
Thank you. Thank you, Chair Horvath. I just wanted to begin by thanking staff for that very thorough overview. It was extremely helpful and very welcome. Thank you. I have 3 questions. When you, to staff through the chair, when you began your presentation, you did reference next year we'll be recognizing the 150th anniversary. Excuse me, I do know that in 1854, cholera exposed over 500 Hamiltonians to death, and probably more because we were so quick to bury people that we often did not link and record. So that led to, I think, a historic first with our waterworks system, because recognizing the relationship between cholera and water quality. I'm asking this because often there is a disconnect, including a disconnect with myself in recognizing why we do things. And often they just become so normalized that we don't recognize the purpose of that investment and how our investments are changing, Chair Horvath, in accordance with new diseases and new dilemmas. So my question through the chair is, are there any plans to recognize this next year in partnership with communications or alike? Thank you. The anniversary.
Through the chair to the councillor, great question. Yes, it is very exciting for that anniversary next year. Within public health specifically, we are planning to have a gathering and a bit of a celebration during Canadian Public Health Week in April. And so we're just in the process of planning that, but we haven't really talked any more about a broader celebration, but it is definitely something to think about and a great opportunity.
Thanks, Manager Earl.
Thank you, Chair. If I could just maybe leave that with the front desk, the senior desk to pontificate. Also the political opportunity that comes as we are going to continue to struggle with budget needs that overtake that which we have. It might be a subtle way in which to underscore the local value of public health investments. Thank you. My second question is in relation to, forgive me, I don't know the slide number, it may have been 19, in which you did reference the report you have forthcoming in April on the Board of Health governance. I just wanted to know if it would be an appropriate time now, Chair, if I could just drill a little bit on the expected deliverables of that report, and if it's too premature for me to drill on that now, whether there would be a time in advance of April so that we have assurance around the table that what is forthcoming is that which is expected through the chair.
Thank you, Councillor. Manager Earl.
Through the chair to the councillor, yes, we are currently preparing that report. I would suggest that we reach back out to the ministry, as Director Stahl had committed to, and we can be in touch with yourself and the chair around that.
Councillor Wilson.
Thank you. I know the interest in it extends to several members of this this body. And so if there would be an opportunity, not just with myself, I believe, I don't want to speak for anybody else, if there would be an opportunity for engagement publicly, or I would prefer, or otherwise, on setting expectations just to ensure we understand those deliverables. Thank you. My last question is, I think it's within the realm of the ask, Chair, and if it's not, I'll take your counsel or the counsel of the clerk or staff, because you did reference your forthcoming work plan. And following on the heels of climate discussions in Egypt, I know the Government of Canada has just recently issued its, I'll make sure I get the term of it, Canada's National Adaptation Strategy, which significantly is different from adaptation. Means we're going to have to adapt to some serious changes within our lifetime as a consequence of the impacts of carbon. Will there, I know we have a climate action plan. I believe there was some excitement within the
Got about a minute left, Councillor.
community of health that there was a specific chapter on health. So in your forthcoming work plan, it references in this document food security, mental health, air quality, infectious diseases. Will there be an opportunity for this body to perhaps receive an overview of that national document and what it might mean for the priorities of this community? Thank you, and that's my last question. Thank you,
Thank you, Councillor Wilson. Manager Giroux.
Through the chair to the councillor, yes, climate change will be part of the annual service plan and budget that we bring forward in February, and work plan around that. In terms of that specific strategy, I can turn it over to Director Kevin McDonald to speak about that further.
Director McDonald.
Thank you. Through the mayor as chair, thank you, Councillor Wilson, for the question. So as you'll be aware from the past term of council, our office worked very closely corporately with our partners on the Corporate Climate Change Task Force and the subsequent climate adaptation plan that council approved and has directed staff to implement. Part of that process will see the health department looking at those specific principles and deliverables as it relates to our own program plans, as it relates to our services and programs. And as part of the ASPMB, I anticipate you will see an incorporation of climate as a priority within our respective program and services outlined in those plans. So each division will be looking, and they'll be weighted differently, obviously, based on the types of programs and services that are delivered. You've highlighted a couple of them in your remarks and your question, but certainly they will be reflected coming forward to you in the next couple of months.
Thank you, Director McDonald. The next speaker on the list is Councillor Huang. Go ahead, Councillor Huang.
Thank you, through you, Chair Horvath. My question is in a general nature. We have some very innovative and forward-thinking organizations in the community, like the Population Health Research Institute, as well as Global Nexus. How closely do we work with those organizations when it comes to data gathering, data integration, and potential use at a cutting-edge public health initiatives?
Through the chair to the councillor, thank you for the question. So when we're doing our population health assessment work and working with our partners in the community, we both do this through some of our research partners in the community, as well as some of the broad organizing bodies at the ministry and Public Health Ontario as well, and certainly always looking for new opportunities to broaden those linkages, both through some of the organizations you mentioned and our partners through the Greater Hamilton Health Network, so that we can share our data and expand our knowledge and understanding of issues affecting our population in Hamilton specifically.
Thank you for that, Director Vickers-Manson. I think as a follow-up question, I have been receiving questions from the community around data and understanding the data specific, most recently to COVID. So when it comes to us working with our partners in the community as well as our own teams, how readily available is data for the public to learn from?
Through the mayor to the councillor, again, thank you for the question. I will just turn it over to Director Prieto, who oversees our COVID-19 dashboard that's currently posted in terms of what's accessible, what's on the content. And I will just remind us, upcoming, we have a presentation that we're doing on respiratory illness in the community, and you'll have an opportunity to see that data firsthand today.
Thank you.
Oh, thank you. Through the chair to the councillor. So we do recommend that you continue to access our website where you can see when the data is updated and how frequently it is updated. We do have, the data is available for the public to consume and to interpret. And again, the best source of for this information is our website.
Thank you. And through the chair, just as another follow-up item to that, much of the information has already been cleansed and sort of curated. So some people would be interested in an open data type initiative. Are there any plans for our public health data to be in an open data format?
Thank you, Councillor Wang. Director?
Again, through the chair to the councillor, thank you for that question. So we continue to have ongoing discussions around the best way in which to share data. So I don't have the answer for you today, but as we continue to have those discussions, we'll certainly provide those updates to the Board of Health.
General Manager Burton would like to add something?
Good morning, Angie Burton, General Manager of Healthy and Safe Communities. Through you, Madam Mayor, to Councillor Huang. We also have corporately an initiative underway about open data, and it has launched in recent months whereby divisions are looking at opportunities to make data open and transparent, and we're happy to take this back and work in collaboration with Cyrus to understand the opportunities with public health.
Thank you, General Manager. Councillor Huang?
Last question through you, Chair Horvath, to Director McDonald for Healthy Environments, correct? Just as a follow-up to Councillor M. Wilson's sort of question, how closely do we work together on sort of determining pollutants that happen in our neighborhoods? In particular, the way I'm thinking about this and structuring this is that in the North End and the Glow Avenue Parkview neighborhood, there have been multiple concerns about fine air particulates that are floating down from heavy industry that's directly adjacent to that neighborhood. So what are the opportunities and how do we as a collective force work together on determining some of the challenges and opportunities with working with our heavy industry, all in the support for our neighborhoods?
Thanks, Councillor Huang. Okay. Director McDonald?
Through you, Mayor, as Chair, thank you, Councillor, for the question. So our office, through Air Quality and Climate Change, works very closely and facilitates Clean Air Hamilton, as well as working with many of our industrial partners. We are a participant with HIA and many of the organizations that are focused on and concerned about air quality in the City of Hamilton. There will be a Clean Air Hamilton annual report coming before this board in the coming months, and Chair Bruce Newbold will be delivering that piece. Our staff have been engaged very much with community, specific neighborhoods throughout the pandemic even, on these concerns, and trying to understand some of the better practices that could be installed in these specific jurisdictions in the city to try and address not only public awareness and education, but various types of intervention that might be possible in terms of realizing better outcomes.
Thanks, Director McDonald.
Thank you, that is all.
That's great. Thank you so much, Councillor Huang. Next on the list is Councillor Clark. Councillor Clark, please go ahead.
Thank you, Mayor. Good morning. During the pandemic, some medical officers of health utilized Section 22 orders. Can I ask through you, Mayor, what is the threshold for utilizing those orders? And are they orders that are decided solely by the medical officer of health or in consultation with the Board of Health?
Thank you, Councillor Clark.
Through the chair to the counselor, thank you for the question. I'm just going to turn to Dr. Bart Harvey, our Associate Medical Officer of Health, to address your question.
Dr. Harvey, please go ahead.
Thanks very much. Through the chair, thank you for the question, Councillor. I agree, and I think as Manager Hero highlighted, 34 health units, 34 different circumstances. So different circumstances may raise issues for that medical officer of health where they feel that an order is necessary. I guess I'll highlight that, as I answered earlier, most medical officer of health orders are intended for individuals. And in actual fact, the order will have the individual clearly identified on it. The pandemic has brought a different circumstance where the opportunity to issue what's known as a class order. So it's really an order for a community. And these have been used. And I think in general, it's that the clear identification that there is a health hazard, the magnitude of the health hazard, and the different options to address that health hazard. And where the medical officer of health, in consultation, usually with their senior staff and advisors, determine that one of the ways or the best way to address this is through an order. But again, in my experience, orders are almost something that's held back and used, when other options aren't available or other options have been tried but have been unsuccessful.
Thank you for that, Mayor. Can I ask, do we have an understanding yet this term as to what the funding ratio is going to be with the province and the city of Hamilton?
Thanks, Councillor Clark. Director Vickers-Manson.
Through the chair to the counselor, maybe I'll just provide an overview and see if I can seek some clarity, counselors. So as Carolyn outlined for us, our funding for our public health programs are mainly 70-30, 70% by the province, 30% by the municipality. And we do have some 100% provincially funded programs, as well as we've received a letter under 5.1 that came forward today around the continuation of COVID-19 funds, and that's been at 100%. So I'm not sure that answers the question. Happy to clarify further if you have some further question.
Councillor Clark.
Thank you for that, Mayor. I would appreciate having some type of perhaps an information report, maybe during the budget process, that lays out exactly what the funding ratios are, which are paid for. The province 100%, which are jointly. It gets a little bit confusing at our end without a document like that. So that would be very helpful. My next question would be, Mayor, what would happen if City Council directs staff to enable citizen appointees to the Board of Health without seeking the minister's authority?
You're asking me that question?
Perhaps to Dr. Harvey and then perhaps back to yourself, but I think it's an incredibly long period of time when we've asked for clarification and we still don't have it. So in light of that, we don't have it, why can't we simply move ahead?
Ask questions later.
Yeah, exactly.
Dr. Harvey, are you prepared to respond to that, or?
Mayor, I think Carolyn is actually probably closer to the details of all of this. So if I may, sorry to, but Carolyn, maybe you can address that?
Director?
Through the chair.
Manager.
To the counselor, I'm going to jump in. Dr. Harvey, thanks so much, and I'll see if Carolyn has anything else to add. And I'll just remind the counselor that there are some steps legislatively that need to be taken in order to make changes to this Board of Health as decided by this Board of Health, and that includes changes to the Hamilton Act and in consultation with the province around the Health Promotion and Protection Act in order to proceed. And I'll just see if Manager Hero has any further details.
Thank you through the chair to the councillor. That's correct. It would require changes to the City of Hamilton Act, as well as the Board of Health composition regulation under the Health Protection and Promotion Act.
I guess my frustration is we seem to have the majority of councillors around this table that have an interest in moving forward, and yet we seem to be getting held back just through protocols, where I would assume that the Ministry of Health would be bending over backwards to assist us as opposed to not responding to our letter. That's me saying that, not the mayor. Let me make that clear. And the last thing, and I don't need an answer on this today, Mayor, but I'm trying to understand the difference between the Greater Hamilton Health Network versus the Hamilton Board of Health. It seems to be confusing.
Could we get a clarification, perhaps an explanation for the councillor?
Through the mayor to the councillor, thank you for the question. I appreciate it can be confusing. So the Greater Hamilton Health Network is our local Ontario health team. So you'll recall Manager Hero spoke to the difference between public health services being mandated under the Ontario Public Health Standards, reporting directly to the Ministry of Health, and Ontario Health as well, being a body that reports to the Ministry of Health. And so we are mandated by the same ministry and separate entities, yet we do work collaboratively together. So for example, our Greater Hamilton Health Network here in the City of Hamilton, both Dr. Elizabeth Richardson and Angie Burden, our GM, are part of the executive of the Greater Hamilton Health Network.
Thank you for that clarification. Thank you, Councillor Clark. Next, we have Councillor Beattie.
Thank you, Mayor Horvath. And through you, during Manager Hero's presentation, we heard about a brief line about pest control. And I'm just wondering through you if we could have a little more building out of what is involved in that program. And then as a supplemental to that, perhaps how it may relate to things like rat infestations and rat abatement programs for the city.
Thanks, Councillor Beattie. Manager Hero.
Through the chair to the councillor, thank you for your question. I'm going to direct it over to Director Kevin McDonald, as he's able to speak to more of the program specifics.
Director McDonald.
Through the mayor, thank you very much, Councillor Beattie, for the question. So our division has historically undertaken the operation of pest control management, largely in response to complaints, which is separate from what Carolyn has highlighted in terms of ministry mandate. This is silent in the Ontario Public Health Standards and our protocols. We are funded at approximately 0.5 FTE wages annually through the levy to carry out pest control complaint investigations and enforcement in conjunction with our colleagues in licensing and bylaw services. Principally, we have found over the years that the vast majority of these complaints stem from property standards issues, for example, whether that be rat infestation, bed bugs, etc. What we're seeing generally across the country and across Ontario, and Hamilton is not unique, in urban areas is an increase in this type of activity. I was pleased to read recently in the Toronto Star that Hamilton did not make the top 10 for the first time in a while through ABEL Pest Control's assessment, albeit that's ABEL's, I think, unique sightline in terms of calls to their agency. Currently, we are not conducting pest control inspections as we're not back at full capacity within our public health inspector complement. So early on in the pandemic response, we had done a comprehensive risk assessment as a senior leadership team within Public Health Services to determine programs of highest risk. Pest control did not flesh out in terms of one of the higher risk activities and thus became a lower priority for our office. That being said, we've continued throughout the pandemic and continue to do presently work very closely with our colleagues in municipal law enforcement, as many of the complaints that we're receiving fall into that property standards deficiency category. And we're having ongoing conversations with our colleagues in licensing and bylaw services now about more efficient and effective ways to address pest control complaints coming from the community, not only in terms of private property, but public property as well, and anticipating and seeing currently in the city larger rates of growth and anticipated growth as it would concern LRT and the Big Dig, for example, and what that might result in terms of displacement of rodents, rats specifically.
Councillor Beatty? Thank you, Director McDonald.
And there's my microphone. Thank you, Mayor Horvath. And through you, the experience in some parts of the city, and I can't speak for any other part of the city but my own, as we, and you made a mention of displacement as we develop areas that have served as natural habitat for, I'll just say it out loud, rats, rodents. We, in our community anyways, are finding an increase in rodent activity, specifically rat, and I know that some of our peer municipalities do have more robust programs to deal with some of these issues, and I'm just wondering if there may be an opportunity for this body to explore something that would be on a scale that would mirror some of our other local municipalities in our response, knowing that as we continue to develop, and you made mention of the LRT project, things of that nature, as a proactive view, can we perhaps put something into motion that would be ready to use when we need it? And I would suggest that there are areas of the city that already do need it, through you, Madam Chair.
Thanks, Councillor Beatty. It seems to me that this might be a conversation to have and perhaps bring a motion forward once you get your kind of arms around exactly what you're looking for. I don't know if Director McDonald wants to respond in the interim.
Sure. So through the mayor, thank you very much for the follow-up. And I can tell you that those conversations have been ongoing with licensing and bylaw services. From my sightline, councillor, we're a very unique community in respect to public health being involved in this particular service. Looking at jurisdictions across Ontario, this largely falls to other municipal services, not public health. And so what we will be furthering a conversation on, and I welcome the opportunity to talk to you about this offline, is how we appropriately marshal in response to this and anticipating what might be occurring given the rates of development and projected development, and looking at more effective and efficient ways to respond. I will close out by saying public health inspectors are not uniquely trained or qualified to deal with pest control, no different than a municipal law enforcement officer who would receive the appropriate orientation and training, for example.
Thank you. Councillor Beatty, I think your time is
I just wanted to really quickly I would welcome an offline conversation about that to follow up. Thank you.
That's great. Thanks, Councillor Beatty. Next we have Councillor McMeekin.
Thanks, Madam Mayor. A couple of thoughts leading to hopefully a useful question. The way data is collected has evolved dramatically over the last few decades. I can remember a time when there was a group called CHOP, Clear Hamilton of Pollution. I don't know if they're still around, but there was a Dr. Victor Cisleone who he gathered data by sticking pins in a big Hamilton map of people who succumbed to respiratory illness and lung cancer. And interestingly, I did a student project on the good doctor. The pins around certain parts of the eastern city where you couldn't fit a pin in anymore. Yet out in Dundas and Waterdown, and you'd be lucky to see, or not lucky, you'd be unlucky to see a pin at all. And that's since evolved. We now have studies on Code Red. We have studies on specific respiratory illnesses and such. It occurs to me in that context that when we talk generically about transparency, there should be no area of public sector involvement where there's more intentionally transparency than in health. And in that context, it's common knowledge that boards, any board, is responsible for three specific aspects: insight, oversight, and foresight. And it's my view that, picking up maybe perhaps on Councillor Clark's perspective, I don't think we're ideally equipped to respond at all three levels there as a council. I think it's embarrassingly inappropriate to not be formally and publicly and transparently engaging in some form or t'other those who know what the heck they're doing. Not that we don't, but know maybe more, different perspective. I'm wondering, given that, a couple things, three specific questions. First, I took from what Councillor Clark was saying that maybe an advisory board, not a formal change to the health legislation specifically. That's one. Is that no reason? I don't see any reason why we couldn't have an informal advisory board to the Board of Health. Secondly, I'd be very concerned that, particularly given the comment about rats and working together with other stakeholders, what our relationship to AMO is. It would seem that the Association of Municipalities has got a role and function to play on the whole healthcare issue. And I context that leadership study out of Harvard says, if you want to go fast, go alone. If you want to go far, go together. So with those, and I guess the third question, when you talk about climate change being integrated into the report, I'm anticipating that will also include food security. So those three aspects, AMO, food security, and data collection, and the advisory aspect. Thank you, Madam Mayor.
Thank you, Councillor McMeekin. Who is prepared to respond to Councillor McMeekin's comments and questions?
Through the chair to you, Councillor McMeekin. I'll start and perhaps turn it over to General Manager Burden for some of the other pieces of it. But in response to your comment around the advisory board to the Board of Health, that's at the direction of the Board of Health and decision at the Board of Health. Our relationship to AMO, I'll just highlight a couple of things. So ALPHA is the Association of Local Public Health Agencies that represent the public health units across the province. And ALPHA and AMO have a strong relationship and work very collaboratively together to collectively hear our voices. And the piece that I would turn to General Manager Angie is her experience at AMO this year and what was brought forward.
Thank you. General Manager Burton.
Thank you, Madam Mayor, to the councillor. We did go to AMO this past summer, and we delegated with various ministers, including the Minister of Finance, as well as the Minister of Health, as it relates to public health. Those would be the two ministries. And we advocated for a continuation of public health funding to cover the ongoing COVID response. We also discussed the importance of the province making the municipality whole in terms of public health services as it relates to COVID response when we delegated with Minister Jones. We can provide the briefing notes that went forward to AMO with that content, and I know that Director Stahl continues to work on those pieces in terms of the government relations strategy.
Thank you. Councillor McMeekin, your time has expired.
The mic is on. AMO's a process. It's not a one-off at a conference with a series of ministers. It's an ongoing process where we can work together, and I'd be interested in hearing, maybe perhaps offline, more about how we're doing that. Thanks.
Thanks, Councillor McMeekin. We now have Councillor Pauls. Go ahead, Councillor Pauls.
Thank you. Oh, there we go. Thank you. Back to the change of the Board of Health Governance. I just remember last time, if we appoint citizen to our Board of Health, maybe I'm wrong, I heard that they couldn't vote, only the councillors could. Is that right, or am I misinformed?
Thanks, Councillor Pauls. We'll have a response if we could But also remembering that we're going to have a full debate on this
Right, I
in
just-
April, I believe it is.
But I just recall saying that if they were elected to be on the board, that they wouldn't have a voting right. Is that right, or did I get it wrong?
Through the mayor to Councillor Pauls, thank you for the question. All board members have a vote to answer your question. I appreciate the referral to the April meeting for a fulsome conversation.
Okay, thank you very much. My last question is this. Just a month before the election, I went to a senior city housing, and a lot of them were upset that under the Ontario dental program, they weren't qualified, and they were telling me horror stories how much they're paying for their dental. Can I ask how many are in our dental program as to date, and are they mostly seniors?
Through the chair to Councillor Pauls, I don't have the full scope of clients that we're servicing through our dental program, but I will give you some facts that I have with me today. So just a reminder, our dental program is inclusive of dental services for children, adults, and seniors. And the Ontario Dental Seniors Program, you will recall, was introduced by the province in 2019, and it's mandated by the province in terms of eligibility criteria, that being 65 years of age and greater, and there's also a financial income component in terms of eligibility. In addition to that, in the city of Hamilton, we do have an adult dental program that we offer as well. That program is funded 100% by the levy. It's a discretionary program. And that program, you'll recall also that we brought forward a report in terms of harmonizing eligibility for our adult program with other services in Ontario Works, and that uses the LIM, or the low income metric, as the eligibility criteria. To answer your question further, Dr. Pauls, in terms of how many people are we servicing, I maybe will talk about some of the backlogs or deficits of care that we're experiencing, in particular to our Ontario Seniors Dental Care Program. So during COVID, our program was not up and running at 100% due to the deployment of staff. We did maintain service for the more acute dental services in terms of treatment. And now that our dental services are up and running, and we are moving towards full capacity while also just finishing up with recruitment, we do have a backlog of services in terms of our seniors waiting for service as a result of the services not being at full capacity for the last number of years.
Thank you for that answer. And of course, COVID has put a wrench in our deliveries of services. And a lot of those seniors, they're saying our income is a little bit higher, just, than what the province wants. And I'm wondering if the province should increase that level of income, because most of them said we don't qualify, and they cannot afford it. So thank you for that answer, and thank you.
Thank you, Councillor Pauls. That concludes the speakers. So I guess on the report, we'll take a vote.
Madam Chair, we've already had that vote.
Okay. Okay, then my roadmap is a little bit off, but that's okay. What I was going to say to the members of council, would you like a 10-minute wellness break? No? We're all good to go? Okay, we'll keep going then. So then the next report up is item 8.2, respiratory diseases update. So we have a presentation, I believe, on this report as well. Who is going to be?
Through the mayor, I'll just introduce the presentation, if I may.
Sure. Thank you.
So this is our communicable disease and epidemiology team that have been doing updates about COVID and how the situation with respiratory diseases more broadly for each Board of Health meeting since the beginning of the pandemic. Today, one of our epidemiologists, Aaron Rodenberg, and Dr. Brendan Liu, a resident public health physician on his senior management rotation with us, will be giving the update. Jordan Walker, Director of Communicable Disease Control, is also here and can answer questions, as can Dr. Bart Harvey, our Associate Medical Officer of Health, who's attending via WebEx.
Thank you.
Perfect. Good morning, everyone. As Director Jen mentioned, my name is Erin Rodenberg. I'm an epidemiologist here with Hamilton Public Health Services, and I'm just going to present the first section of this presentation, which is the respiratory situation report, and then I'll pass it along to Dr. Liu for the hospital capacity, disease control, and vaccine program update. So to begin, we wanted to provide a situation report about what respiratory virus transmission we're seeing currently in Hamilton. The key messages here on this slide provide some of this context. So as you can see, COVID-19 transmission in Hamilton is moderate and decreasing. Our COVID-19 cases, hospitalizations, test positivity, wastewater signal, and active outbreaks are currently decreasing, and our reported ICU admissions continue to remain low. The Omicron subvariant BA.5 continues to be our dominant subvariant here in Hamilton. And while we are seeing these decreases most recently, I do want to highlight that COVID-19 continues to circulate in our community. Also, an update on influenza transmission in Hamilton, which is currently moderate and stable. Influenza case detections and test positivity has recently stabilized, but they are higher than what we've seen prior to the pandemic at this time of the year. So the 2022-2023 influenza season has begun early. Just a note that this is where we're currently at, and we do know that the local situation continues to evolve week after week. So we do continue to closely monitor these respiratory virus indicators and provide updated transmission statuses weekly to the public. And just after the next slide, I'm going to provide the links of where you can find and stay updated to this information. So the next slide I'm providing, as we continue to monitor this respiratory season, this slide looks at providing a visualization of what the impact might be on hospitalizations for Hamiltonians when we not only consider COVID-19, but also influenza and other respiratory-related hospital admissions, including RSV. First, a quick walkthrough of the visual presented. So we've started by providing possible COVID-19 hospital admissions in blue. We've then layered on possible hospitalizations due to influenza in yellow. And finally, we've added possible hospital admissions due to other respiratory illnesses in red. You can see that when the possible hospital admissions due to these viruses are added together, the number of admissions increase overall, which will add pressures to our hospitals. Again, I want to note that there is considerable uncertainty about what this respiratory virus season will look like and when each of these viruses might peak in Hamilton. So this graph really just works to show how the interaction between these viruses will be overlapping and additive. And before I pass this presentation over to Dr. Liu, I just wanted to share the locations of where all this information can be found on hamilton.ca. So we provide an updated respiratory virus transmission summary on Wednesdays. That includes details of some of the key respiratory virus monitoring indicators, as well as messaging about how you can protect yourselves during this respiratory virus season. Also updated regularly twice a week is more detailed COVID-19 data found on our City of Hamilton's COVID-19 status of cases dashboard. And as well, we have more detailed COVID-19 vaccination data on our COVID-19 vaccine dashboard. And I've provided both those links on this slide. One thing I finally wanted to flag are some additional resources that are coming soon. The first is the development of an influenza-focused dashboard where individuals will be able to monitor data related to this respiratory illness. And the second is a new resource tracking active outbreaks, respiratory and enteric in Hamilton beyond just the COVID-19 outbreaks. And with that, I will just pass it on for the next section of this presentation.
Thank you very much. So thanks, Aaron. As introduced by Director Vickers-Manson, my name is Dr. Brendan Liu. I'm a resident physician working with Hamilton Public Health. working with and learning from, of course, the esteemed Dr. Richardson and Dr. Harvey. I'll begin this section of the presentation by just providing a bit of an update on health system capacity, and this is data that is shared in collaboration from our hospital partners, including Hamilton Health Sciences as well as St. Joseph's Healthcare Hamilton. So this first figure illustrates the trends in acute care occupancy at both St. Joseph's Healthcare Hamilton, Hamilton Health Sciences, as well as McMaster Children's Hospital. We are continuing to see high patient volumes and acuity, as well as staffing challenges that are continuing to present significant capacity pressures in Hamilton hospitals. As illustrated in this figure, there has been above 100% occupancy in acute care beds for a number of weeks within the city of Hamilton, which has resulted in some difficulties in the flow of patients through the emergency departments, which have also been seeing high volumes. I will note that Ontario Health's regional and local planning work is underway and continues to work to manage pressures in the hospital and healthcare system as Hamilton experiences increases in respiratory infections such as influenza, RSV, and COVID-19 through the fall and winter months. This next figure illustrates overall critical care capacity for the, again, St. Joseph's Healthcare Hamilton, Hamilton Health Sciences, and McMaster Children's Hospital. And when looking at these metrics regarding our ICU capacity, it is evident that we continue to face occupancy pressures, particularly for pediatric patients, with McMaster Children's Hospital seeing sustained pressure through the ICU system and capacity. This, as a consequence, has resulted in remobilization of resources, including some curtailing of services, such as reduced surgical capacity to maintain care and capacity through the ICU. There is also some triaging of older adolescent patients to other Hamilton hospitals as is necessary. I will also, at this point, highlight the news that St. Joseph's Healthcare Hamilton will be opening a flu, COVID, and cold clinic in Hamilton, which will be providing much needed services considering the significant pressure on our community's healthcare capacity. This will be located at the St. Joseph's West 5th campus site, be by appointment, and is in partnership with Hamilton Health Sciences and community primary care doctors. This service is going to be open 7 days per week, including weekday evening hours, and will serve all ages, and booking will be through the St. Joseph's Healthcare Hamilton website. At this point, I will move to our disease control update. And so Hamilton Public Health Services and the Chief Medical Officer of Health are in alignment in emphasizing a multi-layer approach to preventing the spread of respiratory disease this season. This includes a strong recommendation to mask in all indoor settings, including schools and childcare settings. And this is particularly important for those completing isolation for respiratory illness, and those individuals should be wearing a mask in all public settings for 10 days from the start of their symptoms. This also includes ensuring that we stay up to date with vaccinations, and that includes your annual influenza vaccine, as well as a fall bivalent COVID-19 booster. We want to remind and emphasize around the importance of monitoring for respiratory symptoms on a daily basis and staying home if you are unwell, and as well to ensure good hand and respiratory hygiene and the regular cleaning of high-touch surfaces, which is particularly important for RSV as well as influenza. I also want to note that people who may be at higher risk of severe illness may be eligible for antiviral treatments, such as Paxlovid for COVID-19, Tamiflu for influenza, as well as RSV prophylaxis for very high-risk infants. So if this might be the case for you or your loved ones, it's important for people to be in touch with their doctor to ensure that they have a plan about how they might access these treatments should they require them. At this point, I'll move to update on our vaccination program. So this is presenting data related to COVID-19 vaccine that is available on the City of Hamilton's COVID-19 data webpage and includes the number of doses administered in Hamilton over time, as well as by clinic location and the percentage of Hamilton residents vaccinated by age and geography. This figure presented illustrates a bit of a timeline of our vaccine rollout through our city, including the number of doses delivered on a daily basis through the pandemic. So as we can see from December of 2020, we started to administer our very first COVID-19 vaccines in the city, and that rollout of the primary series continued through 2021. And near the end of 2021, booster doses of the COVID-19 vaccine were subsequently offered. And that represents that middle wave through the end of 2021. And now, most recently, beginning of September of 2022, bivalent COVID-19 booster doses are available and being offered to those age of 12 and older. And that is in alignment with our recommendation around staying up to date with your COVID-19 vaccines and receiving that fall bivalent booster. I do want to recognize that over the past 2 years, over 1.4 million COVID-19 vaccine doses have been administered in the City of Hamilton, most of which have been through public health clinics as well as pharmacies. I will note that more recently, we have seen more COVID-19 vaccine doses being administered through pharmacy, with over half of those being delivered since April 1st of this year, being through that pharmacy channel. This slide illustrates some figures related to our COVID-19 vaccine coverage amongst our total population within the City of Hamilton, and that is that at least 84% have received at least one dose of COVID-19 vaccine, and 81% have completed their primary series. I will note that there is a significantly higher coverage amongst our higher risk older age groups, such that over 90% of those over the age of 60 have completed their primary series, with lower rates of completion amongst a younger population. So while Hamilton's population does have very good coverage of completion of primary series of the COVID-19 vaccine, that we have seen lower uptake of booster doses, such that 53% of our population over the age of 5 has received a booster dose, and that a smaller amount, 22%, have received a booster dose within the past 6 months. And so, again, I really want to emphasize the importance of ensuring that you're up to date and receiving that bivalent booster dose if you have not in the past 6 months. Again, similar to the primary series information, that uptake for boosters is higher amongst older populations. I do want to illustrate this figure around the distribution of our uptake of primary series for the COVID-19 vaccine through our community. And so this illustrates the percentage of the population that has completed their primary series of the COVID-19 vaccine in different areas of Hamilton. Again, this is overall quite high, with most areas over 75% coverage amongst the total population, and many above 90%. And that we still do see some pockets of lower coverage, particularly in some rural areas and lower parts of Hamilton. This figure now illustrates uptake of percentage of people who have received a booster dose in the past six months, with darker areas of the map illustrating higher rates of booster dose uptake and lighter areas having lower rates. And I will note that this is overlaid with red dots on the figure, which illustrate the location of our current mobile vaccination clinic sites. And so that's something that I'll discuss a little bit more in a moment. But I will note that this figure also overlays a number of prioritized areas, which are areas where we have seen lower uptake of these booster doses, as well as overlap with other determinants of higher needs, such as material deprivation and concentration of racialized communities. And this is important in terms of informing current and future vaccine planning and prioritization. So moving into our delivery channels for vaccines at this point in time through our respiratory season, that we are continuing to want to entrench our vaccine administration through sustainable standard channels. And so, as I had mentioned, COVID-19 vaccines are widely available at pharmacies, and this will, for many, be the most convenient place to access a COVID-19 vaccine close to home. Public Health is continuing to offer COVID-19 vaccinations at mobile vaccination clinics, the sites indicated on the previous slide, as well as our Lime Ridge Mall clinic. I will note that this clinic is scheduled to close as of December 21st, 2022, and that staff and resources from this clinic will be then shifted to operate a second mobile clinic team starting in January of 2023. And this is, again, an opportunity for us to focus on addressing barriers to vaccination for high-risk populations and to address vaccine equity in partnership with our vaccine ambassador team. I'll also note that the influenza vaccine is also available through pharmacy as well as through primary care channels, much as it had been in years prior to the pandemic, as well as through high-impact channels such as through occupational health for healthcare workers, as well as in long-term care and retirement homes for both staff and residents. Do want to speak again briefly to ensuring access and equity through our vaccine program. And so Hamilton Public Health Services mobile clinics are really one of our big avenues in terms of focusing on access and equity. And these clinics are placed to serve populations at higher risk of experiencing barriers to vaccination. And so these clinics alternate through a number of priority sites, which have been identified as forward sortation areas and census tracts with lower vaccination rates, as well as higher risk of experiencing barriers to vaccination. As well, our vaccine ambassadors continue to work to build confidence, trust, and share information related to vaccines. And this is a key channel in terms of promoting our Hamilton Public Health Services mobile clinics through established networks and community connections. And we also have an additional opportunity around use of the GoVax clinics, which can add a pop-up vaccine location that is available in collaboration with Go Transit. So I just want to end by emphasizing or re-emphasizing a few messages, and first of which is that now is really the time for a call to arms around ensuring that you're up to date with vaccinations for this fall season. We are currently in the thick of influenza season, and now is absolutely the right time to ensure that you have gone to go get your influenza vaccine. This is especially important for those that are at higher risk, and we know that influenza can be particularly impactful for those who are younger and those who are older. And so individuals who are as young as 6 months old can receive a influenza vaccine, as well as it's definitely a priority for older adults. I also want to ensure to emphasize that we're recommending that you're up to date on your COVID-19 vaccine, which includes that fall bivalent COVID booster, especially if it's been 6 months since your most recent dose. Hamiltonians are also recommended to take a multi-layer approach to respiratory protection, and that includes wearing a mask in all indoor settings, staying home if you are sick, and being vigilant about monitoring and recognizing symptoms, and staying home if that is something that you're experiencing. And at this point, happy to take any questions.
Thanks so much, Dr. Liu. Thank you both, actually, for the presentation. We have a speakers list, starting with Councillor Kretsch.
Thanks for your presentation. I had a question about slide 5, and then a related question about slides 8 and 9. If you wouldn't mind turning to slide 5, that'd be really helpful. I think it's an illustrative question. It's not up there, but I remember it.
Can we
here it
get,
comes.
yeah, slide 5? Is
There we
that
go.
the one,
Yep,
Councillor Crutch?
it is.
Okay, perfect.
I noticed there's a missing axes. There's missing axes here in terms of this chart. It says hospital admissions on the left. And I'm wondering if there's a number associated with those hospital admissions that's somewhere backgrounded that we can't see here. To whomever that might be.
Thank you, through you, the mayor, to the councillor. As I mentioned, this slide is really aiming to be a visualization of how those three, COVID-19, influenza, and RSV would add on top of each other and create those hospital pressures. So the access is not there. It's intended to be a visualization of that additive and layering pressures that would occur in our healthcare system.
Okay, thank you.
Thank you. And through Chair Horvath, slides 8 and 9 I show percentages. And I was wondering if we have the correlative numbers that go with those percentages as well. I know it shows how much of the capacity is there, but for my edification and understanding, do we know also, or not in this moment, I'm not expecting you to produce a new chart, but is that the data of those numbers, the correlate, also available?
So raw numbers as opposed to
Percentages, yeah, pardon me, yeah.
Thank you, Councillor Crutch.
Through you, Mayor, as the chair, to the councillor, thank you for that question. As I mentioned, this is data that has been provided to us as presented through our healthcare system partners. And so unfortunately, I don't have that data at my fingertips right now around what those raw numbers versus percentage might be. But that may be a question that's better directed to St. Joseph's Healthcare Hamilton and Hamilton Health Sciences, as they would have both the specifics around healthcare system capacity as well as the most up-to-date information around this info.
Councillor Crutch?
Thanks. I'm not sure what our data practices are, but just flagging this as maybe something when we're getting the data from them in terms of percentages, we can also ask them if they have the numbers available. I think it'd be useful for us to understand ongoing as much as possible on the different ways that we can read and understand this data. My second question is respect to the pharmacies slide and about the fact that it looks like, if my math is correct and I can add okay, that we're doing better at producing, at having folks come to pharmacies to get vaccines. And I wondered if you could speak to, perhaps, I know at one point in the pandemic it was more difficult to do so. Now it seems to be less difficult to do so. The uptick is happening. What are the factors you think that are influencing that, and does public health have a plan for expansion? And then I have a follow-up question to that.
Dr. Liu?
Yeah, through you, Mayor, as the chair, to the councillor. That's a really great question, and I think a really important point that we have seen considerable expansion of access through pharmacies for COVID-19 vaccines in particular through the pandemic, and those have become a really critical channel in terms of communities being able to access vaccines. We could spread public health clinics across the city and we still would not match the number of pharmacies that are available in the community, and certainly there's a huge opportunity for access that for many people, the pharmacy that's close to your home is going to be the most convenient option. And that's really is helping to inform our shift and focus around where we want to emphasize our efforts around vaccination, and really making sure that we are targeting our resources in the place that's going to be the most impactful, and letting those other channels be reach the right audience in terms of where people are able to access their vaccine. So definitely something that we're paying attention to and using to inform our continued support of COVID-19 vaccination.
Thank you.
Thank you. And through the mayor, could you maybe also say why you think we're having more success now than we were maybe having previously? And then I have a follow-up to that.
Through the chair, to the councillor, sorry, can you just clarify more success through pharmacies?
Yeah.
Yeah, I think that I can't speak to the operational considerations around how vaccines are delivered in pharmacies. I think that through the past 2 years, we've all gained considerable comfort and information around delivering COVID-19 vaccines. And so it may be that through that pharmacies as organizations, or perhaps pharmacists as practitioners, are having increased confidence or interest in terms of delivering this through their services. I don't know that I can speak specifically to it other than that, but certainly it seems like there is more access and perhaps a more even match between demand and appointment availability through pharmacies than there had been during some of the waves of significant demand that we had seen at various times related to vaccine eligibility.
Thanks, Councillor Kretsch. Your time is up, but you can get back on the speakers list if you like. Thank you. Councillor Alex Wilson, please.
There we go. Thank you. And through the chair, just a question following up on that. We saw that the FSA for Flamborough was one of those rural communities that was lower in vaccine uptake, but not necessarily identified as a priority area, because when we layer on other vulnerabilities, could we just talk about then, I'm very curious, when we look at rural Ward 13 or some of the other rural areas, why do we think uptake is lower? I'll point out that there's also not a pharmacy within 10 kilometers of most people who live in rural Ward 13, linking those two thoughts, but curious as to if staff can provide some examples. If it's not the confluence and it's not the layering of other factors, what is the cause in that area?
Yes, thank you. Through the mayor to the councillor. I may actually direct this question to Director Prieto, who I know has been quite involved in our vaccine program to this point. Oh, sorry, should this actually go to Jordan?
Sorry, thank you. Through you, Mayor, to the councillor. So we have continued to monitor the areas where we see lower uptake, including your ward as well. And we do continue to have conversations around how best to address that. Understanding, of course, that yes, there are fewer pharmacies out in that area, which is why we've looked at our mobile clinic plan and make sure that we do have mobile clinics available for constituents in your area.
Thanks, Director Prieto. Councillor Wilson?
A second kind of line of questioning, if we can. I saw very clearly, and I was really appreciative of how clearly we said this. It is a recommendation right now from public health that masks are worn in indoor settings where we can't socially distance ourselves. We also saw quite clearly that we have a role in the previous presentation to be public health advocates in addition to councillors. My question is, in our role as a public health advocate, the Hamilton Wentworth District School Board just asked that all folks using their school property, entering schools, mask while inside. What role do we have to hold up that decision, to support that decision? Can we make an issuance? What are the tools that we have in our communication toolbox to make that decision more effective, given that's something we're also recommending?
Thanks, Councillor Wilson. I'm not sure if there's somebody that wants to respond. Dr. Liu, sure.
Yeah, absolutely. So through the mayor to the councillor, thank you for that question or point. I think it's really important and definitely a message that we want to emphasize, that masks are a very impactful means of reducing spread of respiratory viruses. With respect to decisions at the school board, I think that we would be consistent in our messaging around the recommendation around masks to be worn in indoor crowded settings, particularly where it is crowded, you're unable to distance from other people, or that it might be a space that is not as well ventilated or indoors, as I mentioned. With respect to specific organizational policies, whether those are related to their own policies and procedures or occupational health and safety, I don't know that we can necessarily have a role in the specific implementation of their own policy, but certainly we continue to deliver our message around the recommendation of masks in indoor crowded settings.
Thanks, Dr. Liu. Councillor Alex Wilson?
A very quick follow-up through the chair on that specific point. Is it possible for our public health team to send out a media release saying that the decision by Hamilton Wentworth District School Board is consistent with the best possible public health advice? Could we even just say what we're saying in this room publicly to the media, because we understand that it's not just the advice and not just these recommendations, but how our community converses about them that matters in terms of public health input. Can we be a part of that conversation that's happening right now in our community?
I think the response to that would be a motion, if that's something that you want to move. I think that the public health folks do some of that communicating themselves, organization to organization. Director Vickers-Manson, did you want to take that on?
Thank you for the opportunity, Mayor, and to the councillor. I will just remind councillor that throughout COVID, we had weekly meetings with our boards of education in the city of Hamilton to share data, as we have shared here at the boards of health, and to collectively plan on how to support our students and keep schools open during COVID. And although the meeting frequency is been spread out a bit, we do continue to meet every 2 weeks with our boards of education partners and have developed close relationships where we are having ongoing conversations.
Thank you.
Thank you as well. I'm not sure where that stands, so I'll think about a motion and I'll be in touch on that. My last question is just with respect to schools as a public health promotion location. In a geographically disparate location like Ward 13, where folks can be very dense. So for example, we have 99% vaccine uptake right around Sir William Osler School and Dundas Valley Secondary School. The neighborhood's right beside that, incredibly high vaccine uptake. At Dundas Valley Secondary School, because of the catchment area, you also have folks from that 50% vaccine uptake postal code going to the same school. This seems like a location where public health inputs, whether they're a flu clinic, anything like that, this would be a community health location for many of those rural residents, even though it is in the urban area. Could we speak to a little bit about how our schools could be sites of whether they be get your shot campaigns or things like that, as we're moving from a public health dominated or public health steered approach to something that's a little bit more ongoing and a little bit more collaborative with all of our partners in the community? How do those pieces come together?
Thanks, Councillor Wilson.
Through the chair, thank you, Councillor Wilson, for the question. I am going to give it to Acting Director Prieto, as this was a big part of her portfolio for many years and understands this question quite well.
Thank you, and through you, Mayor, to the councillor. So yes, historically we've delivered vaccines in schools, so we continue to do that with our grade 7 and 8 program for hepatitis B, human papillomavirus, and meningococcal vaccines, and certainly have had great success for that. Through the pandemic response, we have had times where vaccines, COVID-19 vaccines, have also been delivered, and it was successful. The challenge is that from an operations perspective, it's not the easiest for the schools. And it is a bit challenging as well because the children obviously attend school in the absence of their parents. So we did, and like I said, it was a successful COVID rollout, but is not something I think that could be delivered frequently, again, because of the operational issues and the challenges for the schools. That being said, there's ongoing communication, as Director Vickers-Manson indicated, with our school board partners just around the messaging and the education of the importance of receiving vaccines.
Thanks so much. Okay, thanks, Councillor Wilson. We now have Councillor Nan.
Thank you, through you, Mayor, to staff. Thank you for the overview on the respiratory disease update and overview. Couple of questions, and one is around, there was mention of outbreak data that'll be now available online in the presentation. I'm wondering if that information will also be geo-mapped in terms of indicating areas that are having specific impact of respiratory disease outbreaks or surges in population. And from an ongoing health equity lens, what we know from our COVID-19 experience is that certain areas of our city are prone to higher rates of infection, and the metrics of not only higher material deprivation, but other social determinants of health categories. How might this inform how we, as public health, work with our Greater Hamilton Health Network and other partners to best respond with an equity and action approach to influenza and other respiratory disease outbreaks? Thank you.
Dr. Liu?
Through the mayor to the councillor, thank you for that question. I think it's a really important point to emphasize, and so maybe I'll start, and if Aaron, from an EPI perspective, would like to jump in after, that would maybe provide a bit more background. We certainly continue to manage outbreaks of COVID-19 in addition to non-COVID respiratory outbreaks, as well as enteric or gastrointestinal outbreaks in higher risk settings, and so that's inclusive of long-term care, retirement home, as well as other congregate living settings. I will say that I think perhaps more specifically important than geography generally for these are facility-related factors, and that's related to who's actually operating facilities or what those organizations might be. And so certainly as part of outbreak management, we work quite closely and in collaboration with whatever facility is pertinent for that outbreak in terms of implementing infection prevention and control and other measures in terms of reducing spread of whatever disease we might have an outbreak of in that setting, and getting that outbreak under control. Maybe I'll turn over to Aaron around or Director Walker around the specific reporting or dashboard elements of the reporting.
Through the mayor to the councillor. So the specific dashboard elements that are going to be included are going to look similar to what was already included if you're familiar with our COVID-19 outbreaks reporting page, so very similar looking structure. No, I don't believe that it is going to be geocoded. It really is specific to those facilities. But as Dr. Liu has mentioned, when we have outbreaks in those facilities, it's less indicative of what's necessarily happening in the surrounding community, and it's really indicative of what's happening within that particular setting and the factors within that particular facility. So I don't believe there's any intention to geocode them at this time, but our influenza outbreaks as well as our other respiratory outbreaks will be posted in much the same way that we might be used to seeing our COVID-19 outbreaks posted.
Thank you for that response. So supplemental then, knowing again what we know from the COVID-19 data in terms of populations that are at higher risk of being infected. Not only from a facility perspective and congregate setting perspective or higher risk settings, but from a population standpoint. So it's not, just a correlation. It is evidentially proven that certain populations are suffering, I don't know what other word to use, a higher rate of infection and repeat infection. And so the question I have is from a policy perspective, but also from a governing perspective and the core role of public health, which is around communication and education to our public so that we may help mitigate ongoing increased exposure by helping educate our population about the best measures in place or available to them, and what other resources we might need to consider encouraging the network in general to start to concentrate service access and availability in certain areas, knowing what we know today. So I'm getting to the heart of the question, which is, we learned a lot from COVID-19. How are we changing the way that we do things with our network and as a public health agency as it relates to education, outreach, and communication with our population to save them and support them during these health outbreaks?
Thanks, Councillor Nan. Director Vickers-Manson, please.
Through the mayor to you, Councillor Nan, thank you for the question. You are quite right. We have learned a lot during COVID-19, and I think the question you're prompting is how are we applying some of the lessons learned moving forward? And certainly I'll just speak really quickly to some of the things that we're doing within public health, and then as well with our partners, and I'll see if Dr. Liu has anything else to add. But as you know, one of our core functions in public health is to provide population health surveillance, just as you've indicated, Councillor Nan, to see not only who's impacted, but also identify communities that are disproportionately impacted. And the reason for that is so that we can disseminate information so that we can have a whole response in our community to ensure and monitor that we are reaching as best as possible those folks that are disproportionately impacted. And that's inclusive of our own programming. And so Director Prieto and Dr. Liu have already spoken to some of our mobile vaccine sites in terms of providing outreach to those communities in ways that are more accessible and easy from a geographic perspective, in addition to the use of our vaccine ambassadors who have close ties into communities, speak the same language of some of those communities that are disproportionately impacted and have relationships and are able to share feedback in terms of what's working, what some of the needs are in the thinking, and how we can improve how we're reaching out from an education perspective. So in partnership with our Greater Hamilton Health Network, there are ongoing partnership meetings at the GHHN table where we're able to have ongoing conversations around who's disproportionately impacted and what are some of the lessons learned that we need to apply to have a whole health for the community response at the GHHN table to help us achieve our collective goal in Hamilton and protect those who are disproportionately impacted. And so just to be a bit more specific about that, that means sharing of data at the GHHN table, as well as monitoring where we're seeing success, where we're having challenges, and reporting back as a few key examples. I'll just turn it to Dr. Liu to see if he has anything else to add.
Yes, thank you. Through the mayor to the councillor. Director Richards-Benson did cover most of what I was hoping to say, but the only thing I'll add is separate from our maybe very local context within Hamilton. I think in consideration of what was shared in the previous presentation around looking upstream and addressing health equity, action or positions from the past around this board and issues such as paid sick days, I think are very important or relevant in terms of the context of who are the communities that are at higher risk of impact. And we know that this is so much bigger than vaccines. It's so much bigger than masks. It's really, these are really societal level issues. And so appreciate that we are able to continue to take that lens and consideration around any issues of health equity, be they communicable disease or otherwise in the future.
Thanks for the responses. Your time has
I'll come back on a second time. Thank you.
Councillor Nan, thank you for the questions. Councillor Clark?
Thresholds for the Board of Health or medical officer of health to decide to order the wearing of masks in the city as opposed to recommending the wearing of masks?
Dr. Liu?
Yeah, through the... Oh.
Sorry, so Dr. Liu, go ahead, and then General Manager Burden.
Okay, through the mayor to the councillor, thank you for that question, and perhaps I'll keep it brief and then defer to General Manager Burden or Dr. Harvey as needed. But I will say that there's not one specific measure or threshold. This is also always part of a fulsome risk assessment around any public health decision, whether that's a recommendation or an order or any other tool that we may have in our toolkit around public health measures, and so I don't believe that I can speak to a specific indicator or threshold that would necessitate any specific action.
General Manager Burden?
Through you, Madam Mayor, if I could just get clarification, Councillor Clark, were you asking for the threshold or the process?
The threshold.
Okay, thank you. Then I defer to Dr. Liu.
So if I understand this correctly, Mayor, we have hospitals right now at overcapacity due to the strains of the, I might get the acronym wrong, RSV virus that is hitting children, but we're not requiring school boards and children to wear masks. There seems to be a disconnect. We have this incredible overcapacity issue that seems to be incredibly stressful on our healthcare system, yet at the other end, all we're doing is recommending that people wear masks when they're out in the public. So I'm trying to figure out, what is the threshold then?
Well, I don't know that we have a specific threshold that we've been able to nail down right now. I don't know if Dr. Harvey wanted to respond to that, the acting medical officer of health, but General Manager Burden, go ahead.
Thank you, Madam Mayor, through the councillor. Dr. Richardson has laryngitis today, but I do think that it would be helpful to have her weigh in on this particular question, and would be happy to take that back and to be able to get this information to council, should that, or to the Board of Health, should that be of help to the conversation.
That would be very helpful. And
We also have the
oh, sorry. Oh, Dr. Bart.
Associate
Forgot you were
Medical
there.
Officer of Health.
Yes, I am here. Through you, Mayor, and thank you for the question, Councillor. Certainly, not a new question and an ongoing question. I think what we've realized is, like with a worldwide event like this, and so it's not local specific. And really, the 34 medical officers of health have been talking about this on an ongoing basis with the chief medical officer of health. And you know, the notion is we're following the province for their lead. I think any individual locality jumping in, we're going to be left with a patchwork. And so right now, all of us are you know, following, as you would have seen with Aaron. What we've seen right now is we're seeing a peaking of both influenza and COVID-19. So the escalation that we previously anticipated doesn't seem to be coming right now for COVID-19. So, you know, all of us are interacting with our provincial and our other jurisdictional local health units. And, you know, the message is strongly recommended. So people do have a decision that they can make individually. Students in classes and their parents can make that decision. But we certainly haven't gotten to the point, and the province and the cabinet clearly haven't gotten to the point where they feel that, you know, making it a requirement rather than something that people make an individual decision, we're just not there.
so my last question, Mayor, and I appreciate Dr. Harvey's comments. I believe the recommendation is citywide that we recommend people wear masks when they're out in public. What is the policy or recommendation for City of Hamilton staff?
General Manager Burden.
Thank you. Through you, Madam Mayor, to the councillor. As Dr. Liu has referenced, the situation continues to evolve. Last week, I believe it was Public Health, Dr. Richardson put out a memo to staff strongly encouraging the use of masks when in indoor settings and/or when physical distancing could not be achieved as precautionary. It was not mandated. I was connecting in with our city manager, and we are able to take this back to our HR director and have the conversation through occupational health and safety. And it would be a potential consideration that we would mandate staff to wear masks when in city facilities. The scope of authority would be confined to staff working within the city. And that is a conversation we would have at the senior leadership team for the corporation.
Thank you. I'd appreciate it if they could get back to us on that, because it is noticeable when I look around the bench back here. Everyone has a mask on today, as opposed to the other day. It was not the same with our staff and even with our council. So if we're telling the public to wear the mask when you're in public, and we're not wearing it when we're in the city hall common areas, then
Point taken.
It's a disconnect. You know what I'm saying?
Point taken. Thanks.
Thank you, Mayor.
Thanks, Councillor Clark. We now have Councillor Maureen Wilson, and can I just, before I turn to you, Councillor Maureen Wilson, we then have 2 second-time speakers. We haven't gotten to the discussion items on the agenda as yet. And there's another committee meeting in this room at 1:30. So I would just try to ask folks to keep that in mind as we try to get through the rest of the agenda. So with the greatest of respect, Councillor Maureen Wilson, please.
Thank you, Chair. I'd like to thank the previous speaker who raised a series of questions I do. Of course, we know our neighboring jurisdiction, the City of Burlington, has put in a mandatory mask directive for its city staff because they're concerned about the impact of absences and their ability to continue to deliver core services. And I'm wondering if I could, through you, Chair, in the report back to GM Burden, whether she could include in that any observed uptick or not in city absences that might help inform the board in this regard. And just if I could also, through Chair Horwath, just a clarification that that directive, my understanding with the City of Burlington, was a directive that came from its city manager in consultation with senior management, and therefore it was or was not at the directive of the would-be Halton Public Chief Medical Officer of Health. If I could just get clarification, because I'm just trying to understand the role of the Medical Officer of Health in that. Thank you.
Thank you. That's General Manager Burden, please. Thanks.
Thank you, Madam Mayor. To Councillor Wilson, I misspoke earlier. The email that came out last week recommending that staff, or strongly encouraging staff to wear masks, was from our city manager in consultation with occupational health. It was not at the direction of the medical officer of health. I'd also like to confirm that it does not appear that there is an uptick in staff illnesses currently in terms of absenteeism within the workplace. We do have that information and happy to include that as we come back.
Thank you. Thank you. I just one follow-up question. If I could ask the slide to go to that which showed pediatric admissions, if that's possible. I'm seeing the city manager there briefly. I didn't know whether she wanted to comment or.
Well, how about we get your next question on the,
Thank
on the floor.
So I thought I saw a line, Chair Horwath, showing that we are at 100% capacity with respect to the report from MCH, and I just wanted clarification of that. Thank you, through the chair, because it seems counter to everything that's in the media. Thank you.
Dr. Liu?
Through the mayor to the councillor, thank you for that question. So again, this is information that has been provided to us in collaboration with St. Joseph's Healthcare Hamilton, as well as Hamilton Health Sciences. I will acknowledge that it's not up to date to today. You'll note that the most recent data that we have on this figure is for November 21st. At this per this data that we have, it does indicate that McMaster Children's Hospital is at 100% capacity for overall acute beds, as well as let's go to the next slide. As well as at 100% capacity around critical care. I understand there's a number of factors that go into assessing capacity. It's not solely physical space, but it's also related to staffing. So I perhaps what I can say is that the system continues to be stressed and has pressures, but I can't necessarily speak to what the point in time assessment is at this moment.
Thank you. One final question through the chair. As part of the orientation, the theme of the orientation of this board, it would be helpful to me, back to Dr. Harvey, he stated clearly that the 34 jurisdictions are discussing, they're looking at the data. Is the determinant to require a mandate of masking in a said jurisdiction, is that at the feet of the province, or is that within the authority of one of those 34 medical officers, including our own? Thank you.
Dr. Harvey?
So through you, Mayor, to the councillor, well, I think it could be done either way. And as you'll recall, the previous city council had a masking bylaw. So that was a municipal bylaw for masking. So I think there are kind of multiple ways that a mask mandate or any other mandate might be implemented.
Thank you. I think if you have a quick follow-up, it seems to me that
My
Go ahead.
follow-up, Chair, sorry, is a supplemental then in relation to a question that was raised about the school boards. And what is the role of the medical officer of health in the mandating of masks in the jurisdiction school boards? Thank you.
Dr. Harvey?
Through you, Mayor, and thank you, Councillor. So the last round that we went through this, the Provincial Minister of Education and the Ministry of Education was quite clear that that they didn't want school boards on their own mandating masks. Again, if I go back to one of my earlier replies, I think if there was a health harm or a health hazard that was clear and outstanding, then the medical officer of health could step in with a Health Protection and Promotion Act section to make an order.
Thanks, Dr. Harvey. Okay, we now have a second time speaker, Councillor Kretsch.
Thank you. My questions will be brief. They're just following up from my previous line of discussion about pharmacies. It's my understanding, and correct me if I'm wrong, there's a voluntary relationship between vaccination provision at pharmacies and pharmacies participating in that. Like, it's up to them if they participate in this, and to some extent, maybe to all extent. I guess it would be useful for me to see the data across the city in terms of, if we don't have that, maybe bring it forward at a next Board of Health, where those pharmacies are delivering it and where there are pharmacies that aren't. I think that as public health advocates, there's a role for us to play as individual ward councillors, and perhaps reaching out and doing some advocacy to those pharmacies who may not be aware that they can do this, or that encouraging it so that in areas where especially there's not as much uptake. So I wondered if you could speak to, or my question is it correct this is voluntary, and is it possible to provide this kind of data?
Through the mayor to the councillor, I may direct this question to either Director Walker or Director Prieto.
Director Walker?
Through the mayor to the councillor. So you are correct, it is voluntary on behalf of pharmacies as to whether or not they opt into this. But to your specific question about the data on where that's being administered and whether we can, that's something I would have to look into and bring back.
Okay,
I suspect the Ministry of Health probably is aware of which pharmacies are and which pharmacies aren't. I would imagine.
I would imagine too. I wonder if there's a way to capture that data so we can see it though, and maybe get that data. Does it require a motion to do that, or maybe at some appropriate point? I'm not sure.
Yeah. We can do that? We will do that. Councillor Kretsch. Anything further?
Oh, I'm sorry. No, that's all. Thank you.
Okay, thanks so much. So now I need a mover and a seconder to receive the presentation. Moved by Councillor Alex Wilson, seconded by Councillor Beattie. All those in favor? Any opposed? That motion carries. Thank you so much. Okay, now we're actually on to the discussion items. Oh, Madam Clerk.
If I may, through the chair, please. So I understand that Councillor Kretsch does have a motion. We can deal with that now if you wish.
Okay.
Giving staff direction, and I have also been given another motion from Councillor Alex Wilson regarding public health communications. So just to let you know that we have two that we can be dealing with. Either we deal with them now, or we can deal with them after the discussion reports, discussion items.
I'm happy to deal with them now since it's related to this particular section on the agenda.
Okay.
So moved by Councillor Kretsch.
If he would be so kind as to repeat the motion for me, please. Thank you.
Yeah, my motion is that the Board of Health be provided with a report outlining what pharmacies are currently administering COVID vaccines and other vaccinations, I guess, to the point of the respiratory diseases report that are administering vaccinations, and which are not. I think it'd be useful to have that kind of written, as well as some form of geocoded mapping so you can see where those areas are and are not serviced in the city. Does that make sense? I mean, that's a little too specific, but you got the gist, I hope.
I will share my screen so that you can all see the motion.
So we have a motion on the floor to get the information regarding the pharmacies that are and are not providing COVID-19 vaccinations across the city. Seconded by Councillor Alex Wilson. We're just going to have that. Okay. Does that meet your needs, Councillor Kretsch? Okay. Be directed to report back Board of Health on which pharmacies are and are not administering flu/COVID vaccinations with geodata included. Okay, so that's moved by Councillor Kretsch and seconded by Councillor Wilson. Any further discussion on this motion? No? Okay then, all those in favor? Any opposed? That's carried. Oh.
Sorry, in favor? Thank you. Thank you.
Thank you. Then the next motion on the screen is moved by Councillor Alex Wilson, seconded by Councillor Nan. Hamilton Public Health issue a public media release on measures, actions, and steps Hamiltonians can use to stay healthy and mitigate the spread of COVID-19, influenza, and other respiratory health conditions, including specifically the use of masks indoors, and B, and that all communications channels, including the city's social media, be used to promote masking and other recommended measures for the public at this time. So that's moved by Councillor Alex Wilson, seconded by Councillor Nan. Any discussion on the motion? All those in favor? Any opposed? That motion carries in a 10-3 vote. Correct? Okay, thank you so much. Then we can move on now to 10.1, the 2023 Food Advisory Committee Budget Request Report, and I would imagine that's Director Vickers-Manson. Sorry, go ahead. Thank you.
Thank you, Madam Mayor. I'll just introduce the report and turn it over to my colleague, Dr. Kevin McDonald. So this is a routine report from an advisory committee recommending a budget for its work to be considered during the 2023 budget process. Kevin McDonald, our Director of Healthy Environments, and Richard McDonald, Program Manager of Food Safety and Safe Water, are here, as well as Mary Ellen Scanlon is joining online and is the citizen-appointed co-chair of the Food Advisory Committee to speak to the specifics. Ultimately, the goal today is to refer it to the budget process where further consideration would be given.
Okay, thanks very much. Director McDonald?
Through you, Mayor, Jen has succinctly captured all of that. The report is before you, and both Richard and I'm pleased that Mary Ellen is available to join us virtually to respond to any questions, should there be any.
Are there any questions on the report? Okay, seeing none, then can I have a mover and a seconder? Moved by Councillor Huang, seconded by Councillor Alex Wilson. All those in favor? Any opposed? That carries. Thank you very much. 10.2, follow-up alcohol, drug, and gambling services and community mental health promotion budget.
Thank you.
Director Vickers-Menzen, please.
Thank you. Through the mayor, I'll just give a bit of a background on this one. This budget for this 100% provincially funded program came to the Board of Health for consideration in June of this year, as per our usual process. At the report, there was recommendations at that time to reduce staff due to service funding constraints from the province. Given the concerns about the importance of mental health and addictions, the Board of Health asked staff to look for other funding sources for those staff and work. Staff have had some leads, but ultimately they did not turn out. And by the time they were run down, council was in a lame duck position and unable to consider the report, and that's why we're here on this November 28th date. Julie Prieto is here, as well as the program manager, Susan Boyd, to speak to the report, should there be any questions.
Councillor Nan has a question. Go ahead, Councillor Nan.
Thank you. Through you, Mayor, just it's really unfortunate and, you know, clearly an impact of ongoing budget decisions by the province to underfund community mental health supports and addiction services. And in an environment and at a time where our communities are seeing staggering rates. So I was just wondering if I could, through you to staff, get a sense of where are we accessing supports in our community, or where can our community specifically access supports as it relates to these issues outside of this program here in Hamilton?
Hi, Susan Boyd, Program Manager with the Mental Health and Street Outreach Program and Alcohol, Drug and Gambling Services. Through the chair to the councillor, we are fortunate in Hamilton that we do have quite a few programs where individuals can access care. So one of our big providers of mental health is St. Joe's, Hamilton Healthcare. And they do have coordinated sort of access through, and I'm sorry, I think it's Connect, where people can call to access programs that St. Joseph's offers. We also have a community-led case management program for individuals who experience severe and persistent mental health issues, and there's a coordinated access through, it's called Intake, but it's INTAC. And that provides access to the 4 case management programs, one which is ours, but also Canadian Mental Health Association, Hamilton Mental Health Outreach, and Hamilton Program for Schizophrenia can all be accessed through that organization. And I do apologize, there may be some I forget, so I apologize to my community partners if I do. Also with, of course, mental health, we have an adult mental health system and we have a children's mental health system. Children's mental health can also be accessed through coordinated access. Through Contact Hamilton can give access to children's mental health. Within the addiction area, and we also have peer-led services that St. Joe's has access to, and there's different peer-led mental health services in Hamilton as well. And then for addictions, there is a provincial body named CONNEX, so CONNEX, that has all of the sort of programs within the Hamilton area for both mental health, addiction, and gambling. And if residents or individuals within Hamilton call, they can help them sort of go through a process of navigating what might be the best program. And so just to cover a few of our main, we do have withdrawal management programs that are managed by St. Joe's Healthcare. We have Mission Services that provides outpatient addiction addiction support, similar to our program. And we have Wayside House, which is an inpatient program for men. And also, St. Joe's provides our women's inpatient support. And we do have a Choices and Changes program for women who are parenting or have children up to the age of 5. So unfortunately, we do have some coordinated access points, but there also are individual sort of ways to connect with programs.
Thank you. Councillor Nan?
Thank you, and I appreciate that we have those, right? And the challenge, I think, at this time is that access to mental health, we're seeing staggering wait lists across the entire sector here in Hamilton. And then when we think about those populations that have had ongoing and lingering impacts after COVID-19, young people particularly, and then on it can go from different demographic groups. Those wait lists are staggering from 6 months to multiple years in terms of getting access into those coordinated supports and just access to therapy. And this vis-a-vis the province making an announcement during the provincial election season that we would be seeing additional mental health and addiction services being funded. And here we are having to reduce public health staff to enable coordination of those services and access for our citizens. So at this point, I guess my question is, have we heard anything more from the province in terms of those commitments in the budget process, specifically as it relates to those who are experiencing houselessness, as well as other marginalized groups that were identified through COVID-19? And also the supplementary to that one is the COVID-19 funding that is available that we started our meeting off with in terms of the provincial correspondence. Is that an option to be able to bolster some of these programs that are being underfunded now?
Thanks, Councillor Nan.
Thank you, and through the mayor to the councillor. So we're just currently starting to work on some of our preliminary reports for submission, for budget submission. So unfortunately, I don't have those answers right now because we've just started that process. And we do have some reports due, certainly to the ministry shortly, but unfortunately, we're just at the very beginning of our budget process. With regards to using the COVID dollars, maybe I'll have Jen speak to that.
Through the mayor to the councillor, COVID eligible funds for COVID-19 eligibility are directly related to COVID-19 work, meaning outbreak management, vaccination, infectious disease management, etc.
General Manager Burden also wanted to weigh in.
Thank you. Through you, Madam Mayor, to Councillor Nan. The impacts that you are talking about, while they are related to public health services, extend far beyond into other divisions within city government, and it speaks to the challenges that we are having in terms of increased need and not as many resources. The province has confirmed that the Social Service Relief Fund funding that has flowed from the province to municipalities, there will not be another round, and that program has come to an end. So that was a definitive answer that we did receive last week, and we continue to share your concerns around lack of funding to respond to the needs. Thank you.
Thank you. Next on the speakers list, we have Councillor Clark.
Thank you, Mayor Horwath. We have heard anecdotally for the last few years anyways, that there has been an increase in substance abuse, that there has been an increase in alcoholism, that there has been an increase in intimate violence, and there has been an increase in mental health issues. Can we track any of this? Because right now it seems odd that we see an increases across all of those areas, and yet the province is not funding these FTEs. And so I'm wondering if there is a way of us gathering the statistical data to say to the province, children are waiting 2 years to see a psychiatrist.
Yeah.
Because that's what I'm hearing from families right now.
Director Pietro?
Yeah, thank you. Through you, Mayor, to the councillor. So we do use some proxy measures for this data to help move forward with program planning. And certainly, you know, as we're talking about data, we rely on other community partners and organizations to get this information as well. So, you know, as we continue with some of our plans to move this, you know, priority ahead, we will continue to look at what is available for us to help inform that planning.
Councillor Clark?
Mayor Horvath, I guess the challenge that I'm having is if we are to advocate to the province for additional mental health funding and additional substance abuse funding, we need to have statistical analysis to demonstrate this is what the need is and the demand. We don't seem to have that. And so we're constantly in this push-pull. And if we can't present a solid case, then, as you know, they're not going to act. So is there any way of working with our community partners to begin having a solid document that tracks all of these demands within our community? I mean, respecting privacy, obviously, but what those demands are from children all the way to adults.
So like a consolidated list?
Yes, absolutely.
Do we have the capacity to do something like that?
Through the mayor to the councillor, I'll just give a little bit more information and then attempt to answer this question for you, councillor. So just going to remind the Board of Health that we are coming back in January with population health assessment update related to the key priorities that we see emerging, mental health and addictions, of course, being one of those. So we will be bringing data back to the January Board of Health meeting in a consolidated way that will speak to the emergent priorities in our in today's situation. We do have some data and dashboards currently posted, one of which is our Child and Youth Atlas for the City of Hamilton, which is on our City of Hamilton website. And we continue to use that data in a consolidated way to talk about some of the issues, Councillor, that you are identifying. So one of our key accountabilities and responsibilities in public health, of course, is bringing forward population health level data and surveillance related to health inequities that we're seeing our community face. And so that is on the agenda for January, and I just wanted to remind our Board of Health the timing on that.
Thank you. I appreciate that.
Anything further, Councillor Clark? No? Excellent, thank you. Are there any other speakers then to this item? No? Okay then. Can I have a mover and a seconder on the report? Moved by Councillor Pulse, seconded by Councillor Tadison. All those in favor? Any opposed? That carries. Is there any other business? No other business? Okay, seeing none. Can I have a mover and a seconder then to approve the adjournment of this meeting? Moved by Councillor Huang, seconded by Councillor Tadison. I want to speak to this motion. Thank you all very much. It was a long morning, but we got a lot of great information and really do appreciate it. And thanks to the Board of Health members as well for being so engaged in this these issues. So all those in favor? Any opposed? That carries. You can now have a quick lunch and then we're into the next meeting.